Welcome to Resilient Waters Healing in the 10,000 Lakes. I'm Amy. Let's get connected. Today I have the privilege of bringing Dr. Bobbi Gerling on the show. Dr. Bobbi works at The Collaborative, which is a group of independent clinicians who have chosen to work in collaboration to enhance our practices. They offer various types of therapy, training, consultation, and assessments. Dr. Bobbi is certified in EMDR, air network therapy, and grief counseling. She has worked in the field for over 30 years in a variety of therapeutic settings. Hi, Bobbi. Thanks for
Hi.
joining me today.
Yes, awesome. I'm glad you're here.
Yeah, I'm very thrilled and honored to have you on here. I know we have worked together in the past for the last couple
hmm
of years, mostly from a distance. I've even taken some of
hmm
Bobbi's trainings, and so I'm just really excited to have you on and give everyone a chance to hear from you the really cool options that you give our clients. So,
Yeah,
welcome.
very cool. Yeah,
So,
love to
Bobbi,
share.
oh,
Yes,
I know. I'm so excited. Can you tell me a little bit about how you came to your clinical focus?
sure. So, right now, I am part of a collaborative, and that we are a group of people that we have chosen to work in collaboration with each other to enhance our services. And we've been together since December. And before that, I've had a long history of different types of employment, different types of environments and populations that I've worked with. But I think one of the things that stands out to me early on is there was a traumatic event that I experienced when I was in grade school. And since then, there's always been this question or wondering like why things happen or why people are the way they are, or just trying to gain some kind of understanding around that. So I think that started the whole thought process of going into psychology in general. And then my mom tells this story, and I don't ever remember saying this, but she said one day I came up to her and said, I want to be a psychologist. And I don't know, like, I don't even remember knowing that word back then. So,
Right.
I mean, I just like, okay, well, I believe you, Mom. Yeah. So I think that just kind of started kind of the journey in this whole process. And I haven't looked back. I have only had degrees in psychology. You know, all my elective classes were in psychology. All my volunteer work was in psychology, and it's just been a passion of mine I guess ever since grade school.
I love it. It's like it was called to you. This was you always just kind of knew.
Yeah,
I love that. You
yeah,
know,
for sure.
I just from working with you, I can feel that passion. And I know I have had people come back to me and professionals talk to me about what it's like working with you, Bobbi. And they always say that same thing like, you're
Mm.
so comfortable, you have so much knowledge, and it just makes it
Oh,
such,
that's great.
like you said, I love that the name that you guys chose, the collaborative, because that makes it,
hmm
that resonates with the experience of working with you, that it is a collaboration, not a I have to just
hmm
do this testing or whatever it is that we're doing in the office. It's not you're the expert. I just have to
Definitely.
listen. It's a collaboration, working together, understanding. And it makes it such a big
Right.
difference for people. So thank you. I'm so glad that you're doing this
Yeah.
work. I really am.
You had mentioned the collaborative, and I didn't even think about it, but yes, in my own work, in the testing that I do, it's a collaboration, and so that was really cool that you said that. I didn't even think about that. So yeah,
It's one of the first things I
I like
thought
that.
of when I heard about when you moved to this new space and started this collaborative together. I thought that's perfect. It's
Mhm.
a perfect description.
Yeah, very cool.
So Yeah, so tell us a little bit about who the types of clients that you typically serve.
Sure. So I typically see clients probably late adolescence up through adulthood. And typically they're, well, some are self referred, but a lot of them are referred from therapists or county workers or different things like that to complete a psychological evaluation. And so it's just a range. I see a range of people with all sorts of backgrounds and history and experiences. And yeah, I can't like specifically say like this is the only population I work with because it seems so broad. So I just anybody who is in need of something that could be helpful in understanding who they are, I think I'll see definitely.
Awesome. Yeah, tell me a little bit more about the types of assessments that you do and what clients, like for those who've never done a psychological evaluation, like what they get afterwards.
Hmm.
That can be so helpful.
Sure, sure. So just to kind of give some background on what's the purpose of a psychological assessment. And the purpose is really to answer specific diagnostic questions and give really clear, specific, reasonable recommendations for people as far as what are their next steps. And so it helps inform treatment. It helps the therapists that are working with these clients kind of have some direction to go in. It really helps give some understanding to clients about how they've been impacted by different things in their life. And we really look at strengths. We really look at the unique experiences that a person has. And we look through a trauma lens. And what I mean by that is we look, we help clients, therapists, those involved in the client's life really see and understand how trauma has impacted them in different ways throughout their life. And I think a trauma psychological assessment is different from just a kind of a general psychological evaluation because I look through the trauma lens and I look at how different things have impacted the individual and I've talked to those and help an individual like understand all these different kinds of ways. We look at interpersonal, we look at self, we look at strengths, values, and we bring that all together in this evaluation. And so we don't look at disorders or deficits, but we really focus on strengths and core values and capabilities and ways that people have grown through their experiences.
I love this approach that you have, Bobbi, because as a clinician, whenever I get your assessments and information back when working with someone, I have great tools and recommendations to use to help not just differentiate a diagnosis, but make sure that we're working with their strengths and the skills and resources they already have and build upon them
Right.
in order to help find relief in the things that they're struggling with.
Yeah.
And I don't always necessarily find that approach in all the assessments that I get sometimes. And with yours, I really do feel that and I see that. And, I know in the past too, I've been able to collaborate with you as a clinician and talk to you with a release, of course, so that we
Yeah.
can discuss kind of what you noticed and what you feel the best approach would be for someone that I'm working with. And I think it's
Definitely.
really important. This is why I really wanted was really excited to have you on this podcast so people could hear that this is a very useful and helpful tool, and service that you provide, especially
It's
when people
awesome.
have a lot of questions for themselves about
Yeah,
how do they fit
for
in.
sure.
And I hear all the time, like, well, what is this diagnosis? What does this mean? And to have someone
Mm-hmm.
like you talk to them about their strengths and values in
Mm-hmm.
relationship to what they're dealing with is
For
very
sure.
important and healing.
Yeah, for sure. I think that there are so many clients that come in, for example, that have maybe received, a few psychological evaluations in the past or have been given many diagnoses. And a lot of them sometimes are just afraid to come in and don't know what
Yeah.
to expect. And what am I going to be asking them? And what are they going to be expected to do? Are they going to have to talk about trauma in detail? Is this going to be a one-sided process? Is it going to be a collaborative kind of relationship? And so they come in, with these different past experiences, but also just like, I've had so many diagnoses, I don't understand. Like, I want to understand myself more, and I want it to really fit. And so when I do
Yeah.
talk with clients in our feedback session, I really talk about, does this seem to fit? Does this like resonate with your experiences and who you are? Because I really just want to make sure that I'm not just, reading a report, just putting it in written form, giving it to the client and being like, here you go. I mean, I really want to kind of work with them in this process. What kind of recommendations are going to be the most helpful for you? What can we focus on that is something that you can actually participate in instead of these lofty, kind of treatment recommendations too. So,
Absolutely. Absolutely. Even just talking with people around this experience sometimes otherwise can cause some anxiety or maybe feel like judgment or things like that. And
for sure.
this this work that you do is very different from those experiences that
Mm-hmm.
people may have had in the
Mm-hmm.
past around testing, even just going through the school system and feeling like any taking a test there's got to be some sort of right answer, and that's not true for
Mm-hmm.
this experience.
Right.
And I'm thankful
Yeah.
that this is what you can offer for people, because otherwise it can
Mm-hmm.
be very hard sometimes.
Yeah.
Thank
For
you.
sure.
So
Yeah.
if someone were wanting to get an evaluation done, how does that process work? How do they find you? How do they sign up for it?
Sure. So right now, you can find myself and my collaborative colleagues on our website, which is thecollaborativemn.com. And there is my email address, my phone number for you to get in touch with me. You can either, clients can either come in self-referred, like I just want to know, kind of knowledge about what is going to be helpful for me to function the most effectively that I can. And so self-referred therapists can just give me a call. It's just like, it's just as easy as just picking up the phone and saying, I would like to make a referral. Or a client says, I would like to, kind of go through some testing with you. So it's a really simple process. There's no big referral forms or anything like that. It's just a phone call. And then after I do that, I have everybody kind of on a wait list where I, and the reason why I do that is because I want to be able to take the time that each client needs for this process instead of just like, okay, we're going to do this one in 1 week, we're going to do this, in the next week, and really be able to make it a process that they feel comfortable with. So that's why I put everybody kind of on a wait list when I get their name, so that I just kind of call them up when their name comes up, and we just start the process. And then once the process started, it just kind of flows through until we finish. And yeah, so that is the kind of the beginning part. I then make contact with the client. We set up a session for them to come in and do more of a history taking session where I just gather information from them, history from them, get releases signed, answer any questions that they have, talk about them, talk about the process with them, and just kind of build that rapport before we kind of go into the next stage. And the next stage is doing the actual testing. And so
Yeah.
that can range, depending on what a client comes in with as far as their needs or therapist referral questions. So with that, it can, there is a strictly trauma evaluation that I do that just focuses on trauma and how it's affected a person, how they've grown through these different experiences, what is going to be most helpful. But I also do an overall trauma-informed psych eval that looks at cognitive, looks at personality. So I have a bunch of different assessments. I have a battery of assessments that I do. And it just kind of depends on what a client comes in with as far as their needs.
I love how person-centered your work is, how you take your time so that people aren't feeling rushed or like they're on some sort of conveyor belt timeline of you have to have this done,
Right.
in this amount. Because I do hear those things, our field can get very busy and things can get bogged down a little bit. And so sometimes as clinicians, I know we feel a little rushed, and that can definitely come through. So I love how you slow the process down for people. That makes a big difference.
Yeah, for sure. One of the things that I really try and focus on too is making a client feel comfortable. And a lot of times when people come in with trauma backgrounds, they can experience a wide range of emotions, and different questions, different scenarios could be triggering for them. And so I always take time to ask kind of what are the skills that are most helpful for you if you're feeling dysregulated, or if what do you need? Do you need to take a break, walk around? Do you want to bring in, breakfast? Do you want to bring in your emotional support animal? Let's really focus on focusing on the skills to be grounded throughout the whole time. And if I notice, I'm sitting with the clients the whole time, so if I notice anything too, I'll just kind of stop and just ask them how they are, and if they need a break or anything like that. And so I want this process to be able to have clients feel like they can stay within that window of tolerance. So they're not hyper aroused or hypo aroused. They can just feel in their most resource self when they're coming in and completing the evaluation.
I'm so glad people can hear you talk about this right now, because this is what I have been telling people about working with you, is it's very comfortable and you're going to work with them and it's going to be very trauma informed care. And
Yeah,
we're going to be
sure.
able to get some good information and understanding. So,
yeah, and I think too that I want to give them a sense of control as well. So letting them know, you get to disagree with me. You get to ask me questions. You don't have to talk about specific things if you don't want to. I'm not going to ask you to talk about specifics about your trauma, and just really be transparent, explain the whole process to them. But also, I think a really big part of it is giving them education as far as how trauma impacts the brain, and being able to kind of put in some of that education so that they can understand, okay, this is why. It's not because I'm I'm bad, or there's something seriously wrong with me, or, what other people may have told me in the past. This is why. It's because my brain has been impacted in these different ways. So,
Yes. Oh, I just can't underline this information enough, because especially when it comes to testing, that's not always the feedback that I get from clients about their experience.
sure.
Because it's like very quick sometimes, and they just need the information fast, and that kind of negates all of this other, like, let's take our time and really get to know what's going on and get
Definitely.
really good information and education at the same time. Like, this is a service for you. You can, benefit from right here, right now, in the moment. I love that.
For sure. And after we do the evaluation part of things, then I will kind of go through all the kind of test results that I've received and really kind of look at specific things within these testing scores and make sure that I'm understanding how a client is or why they're answering in a certain way. Because I think that's so important, because, for example, if a client is checking true for I experience visual hallucinations, okay, well, what does that mean? And so I will always follow up. We'll have a follow-up session where I go over specific questions to get a better understanding of their answer and why they answered a certain way. Because I think if you just do a blind interpretation, it's not going to be accurate, because
No, it's not.
clients answer things in different ways, and they maybe understand the question differently. So we always have that follow-up session to just gain clarity.
Absolutely. I see that often, and I think too our internal experiences vary. People experience things differently. And I love that you asked the question then of, well, what did that mean for you? And how can I understand this better? Because, we're both people and we have experiences, but, we all grow differently. Our brains are not identical.
Definitely.
And we don't have the same thing. So I think that's so very important. And great information for everybody involved. Because I think all those messages that we get around psychology and diagnosis can be that blanketed something is wrong. Well, that's
Exactly.
not really the whole truth, right? Like, that's not really what's going on here. So,
Yeah,
awesome.
exactly. Yeah. So we do that, and then the last time that we meet is a feedback session where I go over the results, we go over the report, I answer any questions, see if it fits with what their experiences are and how they see themselves, and so we just that can take one session, two sessions. It just kind of depends on what the client is wanting from this experience and how it can be most helpful to them. So after that, then I, follow up with any referrals or recommendations, help them maybe get connected with some different agencies that could be helpful to them. And then I always leave the door open if you have any questions, because it's a lot of information to take in. When I go through the report with them, it's like, oh my gosh, it's like 9 pages, of this is all about me. And some clients are like, this is just like so overwhelming because you've like put all of my life, who I am in 9 pages, and we're just like, and sometimes they need to process it. They need to like slow things down, take it home, read through it. So I'm happy to meet with people for, a couple sessions after just to do that too.
Oh, that's fantastic. Because, getting handed a 9+ page document on themselves can feel very overwhelming.
Yes, yes,
And
for
there's
sure.
a lot of information, and the testing, some of the language that's used can be hard and not common. And so I think that's so wonderful that you can take that time to explain all those things, because
For
it is, like
sure,
you said, it's
for sure.
about them. It's about them. So,
Right. This is what do they want? What do they want to know? How can this be helpful? Yeah, this is not about let's just do this quickly, give you a diagnosis, recommendations, you're on your way. It's I mean, that's the way I would want to be treated if I
yeah,
were given a trauma-informed psych eval.
absolutely. Absolutely. Everybody deserves
Yeah,
that kind of care and respect in this process, because it can
definitely.
be so hard. It can be so hard. So often people want to know, of course, when they're going to get services like this, that information on, what does payment look like? Can I
Sure.
afford some of these services? So what does that look like for you?
So I take both insurance and private pay.
Okay.
The insurances that I take right now are Health Partners, Blue Cross Blue Shield, Medicare, Medical Assistance, UCare, and there might be a couple more in there that I can't think of right now, but I will always ask, in the first phone call what insurance they have and talk about that with them to make sure that they can get what they need. And
Yeah.
so I always will call their insurance companies and make sure that we're good to go as far as any kind of prior authorizations. But also sometimes, I don't work with certain insurance companies that clients have, and so then we'll do private pay. And the way I do private pay is really work with them as far as what is going to be kind of affordable for you, what is going to be a way that maybe we can spread the payments out, just having different conversations about how it can be, something that they can afford and feel like they can afford, even if I don't take their insurance.
Yeah. Again, that collaboration, accessibility. That's great.
Yeah,
I'm glad that you can
yep, for
offer all
sure.
those, and that a lot of these things can be covered under people's insurance. I know that can be
Oh, for
a
sure.
huge
Yeah.
question for those. So thank you.
Yep.
I
Yeah,
know
for
we've
sure.
talked about, I will make sure to list underneath this podcast in the resources section how to find you, your website, email information. So I'll make sure to post that here for everyone who's listening. You can check that out. Are there any resources that you'd like to share with people?
Sure. Well, I think a lot of the resources are part of this collaborative group that I'm in. We all have different strengths and gifts in different areas. And
Yes.
so I would just encourage people to really go to the website. We have somebody that does animal assisted or equine therapy. We have somebody
Yeah.
that does sensory motor, EMDR, air network therapy, which is working with complex trauma. We have an occupational therapist, a person that does neuropsychological testing. So it's like we have just a huge range of kind of services within the collaborative. So I think that's what I would recommend most.
I recommend that often. Honestly, as a
Yeah.
clinician, I'm always saying, well, there's this wonderful office that you can check out in Eden Prairie called the Collaborative. There's lots of different resources here for you, and people who have, like
Yeah.
you said, lots of gifts and really cool
Yeah.
resources for people. So I'll make sure to list the full website, and people can check that
Great.
out.
Yeah. Great.
I
Awesome.
also had that question that I always ask clinicians and people who come onto the podcast, if there's another question that we can ask, and kind of more of a fun one. But I know you chose, what is one thing that you want to debunk about your job?
Right. Well, I thought about this. I thought about how psychologists are portrayed in movies. I thought about like the kind of the expectations that clients have when they come in, what it's going to be like. And I think one of the biggest surprises that clients have is that we're not perfect. We don't have it all figured out. We struggle with our own issues. We see therapists ourselves.
Yep.
We like, for example, when I do couples therapy, oh, your marriage must be perfect. Well, no. It's like a lot of the stuff that I use and we talk about in session are things that I'm using or that I've used in the past. And so I think clients are just like amazed, like, you don't have a perfect life, everything figured out. And no, I don't.
No, that doesn't exist. There is no perfection.
Right.
We're all doing that. I love that. I knew this was going to be a fun question because there's just so much to debunk from this profession in general. And so I'm really glad that you brought that up. No, I like that part too, because I use a lot of the skills and resources that I bring into the therapy space in my own life, and I do that because they're helpful, and we all benefit from that.
Yeah, that's why we suggest them.
Yep. Right. Yeah, I don't suggest the things that don't typically work for me or for others. So.
Right,
Yeah,
exactly.
Absolutely. I love that. Well, thank you so much for bringing your expertise and understanding and collaboration. I'll continue to use that as a description here, because thank you for bringing that to the table, being willing to talk to us today about this great service that you offer. I really appreciate it.
Well, and I just appreciate you asking me to be on this podcast, because I think, there's not just, it's hard to find somebody that does psych evals, but one that specifically focuses on, looking at it through a trauma lens, and just getting the information out there so it's not such a scary process too, I think. So I'm glad that I can offer kind of this information to help therapists and clients kind of just understand and feel more comfortable if they decide this is a route they want to go.
Absolutely. I refer to you, as you know, and I'm always speaking very highly about this because there is not a lot, like you said, of trauma-informed resources out there, especially in testing. And so there's a few of you, but I'm so glad to be able to highlight this as a resource locally here in Minnesota, and a very accessible one as well. So thank you so much.
Thank you. Yeah, thank you.
All right, guys, this is the legal stuff, the disclaimer. The podcast is intended for educational purposes only. The information provided is not a substitute for professional therapeutic advice or counseling. Always consult with a qualified mental health professional for any personal concerns or issues. The views expressed on this podcast are those of the host and guest and do not represent the views of any affiliated institution or organization. Listener discretion is advised.